Very good afternoon, everyone, and hope everyone is safe, fine. And it's my honor to welcome all of you on one of the dialogue series, which is initiated by DocMode called GAPSULE. GAPSULE is a first of an industry dialogue series and aimed at bridging the knowledge gap between the pharmaceutical industry and medical practitioners for better treatment outcomes. Today, we are going to discuss and talk about something very relevant to bridge the gap between the medical therapy and the importance of nutrition perspective. As an individual, we all know nutrition plays a very important role, and we keep balancing our gap between the food what we intake and maintaining that if any gap is there by having some kind of nutritional supplements in our day-to-day life. But what is very important to understand, even post pandemic, everybody has certain kind of needs, but in especially patients who have certain kind of ailments, kind of hospital patients, or a patient who are on some kind of chronic therapy, their need is different, and market has changed. And how to make sure that medical practitioner perspective, how a patient knows that what is the exact need of nutrition for them is something the industry is working upon. And there are a lot of advancement, and there are a lot of information awareness has been initiated to discuss upon on these all perspectives. Today we have subject matter experts with us, and I would like to welcome all three panelists what we have today. First of all, I would like to introduce Mr. Prashant Mehta. Welcome, Mr. Prashant, for the today's discussion. So, Mr. Prashant is a very distinguished leader in different segments of medical therapy. But the most important point, his 14 years of career has interesting acknowledgements. He has been a part of critical care section, anesthesiologist sections. But most important achievement in the nutritional segment is initiating the idea of implementing the novel Japanese clinical nutrition concept in Indian hospitals, which was one of the uh, first of its kind of concept what they have introduced. So, welcome, Mr. Prashant, for the today's discussion.
Thank you.
Our another panelist, Mr. Proshanjit Dey. He's currently heading the marketing Dr. Reddy's. Welcome, Prasanjit, for the today's discussion. He's also called as PD and popularly known from last 2 decades experience in sales and marketing in different industries instant like Nestle, Kellogg's, Novartis in the nutrition segment. And more than that, he's passionate towards understanding and gathering the knowledge, information around 4 dimensions of all the shapes of life, like mental, spiritual, and physical and emotional well-being. So it will be an interesting point to discuss upon how these are all segments are very helpful in terms of understanding the nutritional gaps area. Another important panelist what we have today is Mr. Satyajit Bagchi. Welcome, Mr. Satyajit, for this today's discussion. Satyajit is currently working in Nestle Health Science and have almost a decade of experience in it. He has worked across companies like Emami and Sanofi in the past. Uh, Welcome, Satyajit, for the today's discussion. So let's start the discussion. As I mentioned about talking into the nutritional perspective in patient care, the first and very important point what we need to understand is we know all that medical therapy and proper treatment is crucial to a patient, but other factors like nutrition is an integral component to patient's recovery and healing journey. And we all know that even in the past, when there is not too much evolution of nutrition perspective, our uh, parents, our grandparents keep giving us something related to that so that our recovery is much better and stronger. So we would like to understand what's happening in India as of now, that we should make sure that the nutrition support to patient is going to be delivered on a right time basis. So let's start this point of question from first, Mr. Prashant. What is your point of view into it?
Yeah. So First of all, thank you very much for giving this opportunity. When I talk from my perspective, like when we are talking about nutrition, so nutrition majorly, specifically in clinical nutrition, like what we are dealing with last 10 years, that nowadays scenario has been entirely changed. Now, if you see infrastructure in hospitals, whether it is corporate hospitals, trade hospitals, infrastructure has been improved. Nowadays, dietitians are available in the hospitals. Nowadays, assessment techniques has been utilized, and specifically like protein, energy, malnutrition, that kind of things has been specifically taken care. And based on the assessment, based on the physiological condition, and based on the disease specific condition, nowadays nutrition has been initiated, which is helping patients simultaneously. Now the things has been more scientifically driven. Previously we have observed maximum number of hospitals they used to have kitchen fit. Nowadays, if you will observe and if you will think, now almost 90 percentage of corporate hospitals, they are driven by commercially utilized formula. So where it can be totally monitored what kind of proteins, what kind of fats, and what kind of carbohydrates has been given, what kind of nutritional profile, what kind of vitamin mineral profiles has been given to the patient. So if you see, many initiatives has been taken in last decade, specifically by industry also, because a lot of awareness has been created in last 10 years. Simultaneously, hospitals have also understood that it is going to play a very important role in patients recovery, and it has been proven. If you will go through SPEN guideline or American guideline, or if you will go through some of the Asian countries guideline, it has been proven through clinical data that nutrition is playing very important role, which has given very positive impact. And based on that, a lot of improvement has been done. Now, if I talk about one example like Tata Hospital, now they are catering almost 4.8 million patients across India who are cancer patients specifically, and they are taking care of all the patients, and they are giving specific nutrition and commercial diet to these of the patients, which plays very important role, not only their recovery but post recovery also, during the hospitalization and post recovery also. So from my perspective, a lot of improvement has been done, and we are in a positive direction. But still, it is a long way to go because we have a lot of challenges, and as an industry and as a healthcare industry, we are dealing with it. Yeah.
Thanks, Prashant. I think, well, to start with some of the key point what he has highlighted in terms of the most nutritional experts, which have been now very much aligned to all the hospitals, in not only in terms of prescription importance, but in terms of maintaining the patient's adherence into it. So, since from the other side of the story, Satyajit, we have seen that how a patient, generally we believe that patient goes to a doctor, visit, have a proper medical therapies discussion, but when it comes to nutritional perspective, he go and do some kind of window shopping and a lot of marketing related information which is there in the social media, and they get attracted to it. "Okay, this looks much better, let me buy that wine." So the guidance, and we have seen the barriers in terms of giving the right concentration from the HCP perspective. So how we can bridge that particular gap?
It's a very valid question, in fact. But just reflecting on what Prashant had mentioned, and you also touched about this parents and all. So, my father is a doctor with over 35 years of practice, and it's a very curious case that when I talked about nutritional supplementation, it was never his focus. So, in those days, it was possibly not even taught in part of the curriculum, or it was not given due course. In fact, my brother recently graduated as an MBBS doctor, and even there, one of the biggest challenges there is the doctors are not possibly taught enough or sensitized enough about nutritional therapy. And one of the largest challenges is possibly the time aspect of it, because in a public hospital, for example, there is a huge inflow of patients, and the doctors would rather focus on getting that patient out of the ICU. So nutrition is possibly delegated to the nutritionists or even the nurses and all. So, but there has been a sea change. In fact, I have seen my father recently with a lot of coming across different scientific education, is now started recommending the diabetes supplements, for example, diabetes powders and all for his patients and all. So, although it's still, I would say, a baby step, for my father, but it's picking up for sure. Now, what happens as a result of this is that while the doctors are themselves not convinced, the patients
Mm.
are or the consumers are left to themselves to make their own decisions, whether it be through source of information available on digital or TV communication and all. And there is where there is a huge lacuna. So, in fact, say for example, Prashant was mentioning about protein supplement. In that space itself, it's a hazy area. So people don't know what is the difference between, say, a malt-based food drink or a balanced nutrition or a protein supplement.
Right.
And this is
Right.
where the organizations like us need to play a very clear role rather than bombast with marketing jargons or claims which are not validated. It is our responsibility to ensure that we provide the right set of information to our consumers.
Excellent point. Prashantjit, just adding the conversation point, what Satyajit is trying to say, the right marketing information, which is somehow I believe is somewhere get mixed up in multiple platforms. Streamlining that particular thing at the doctor's chamber. What we keep seeing it, that recommendation or the counseling. These are the two major aspects where I feel that patient also have a lot of challenges. Ki I should listen to whom? To marketing jargons, or I should listen to doctor jargon, because both are talking something different. So, what is your point of view to minimize this gap?
See, I think there are a couple of challenges, as Satyajit was saying. There are a couple of challenges. One, when you look at the doctors, so typically you have a challenge because there is a lack of time. There is paucity of time in terms of the practice. There is a huge burden of patients. Also, if you see the conversations around nutrition, typically with the healthcare professionals, is very generalized. So the moment the conversation happens, it's majorly around the cure side of it, and then when it moves into nutrition, it is around the do's and don'ts. What the patient should not be having. It's not so much about being proactive in terms of the whole nutrition management. Now, also, if you were to see the challenges from a patient perspective, when they come over, typically, they have never done a dietary assessment. They're not even aware as to what is the right kind of diet that they need to take. And there is also a lack of awareness around what's appropriate, at least for the condition. So like what Satyajit and what we were hearing from the panelists is there is specificity to the condition, right? And there is nutrition which plays a very specific role in each of these conditions. So there is hardly any guidance, there is hardly any counseling, there is hardly any specific discussions around those areas, and therefore there is a big gap that arises. Now, also, if you look at the other end of the spectrum when it comes to the patients, which to your question, there are a lot of myths and taboos around nutrition itself. So what's right? I mean, typically the discussion is around the calories. This is the kind of you need to maintain 1,500 to 2,000 calories per day, but the discussion is never around nutrition. What's the right nutrition I need to take? So just like let's say a bowl of broccoli is not equivalent to let's say a bowl of any other cereal that you give. So the calorie intake could be very similar, but then the nutrition is very different in each of this in each of the servings. So that's one of the big challenges. Also, when you hear conversations around let's say protein or around the majority of the discussion is around is protein good, because too much of protein can load the system.
Yes.
It's not that great. So and the dichotomy is 70 to 80% of our population is protein deficient. Almost
Exactly.
95% of our population is fiber deficient. So it's not surprising when you see all these metabolic conditions. So there is a huge amount of disconnect, both from the healthcare point of view as well as from the patient point of view. And I think how do you overcome these challenges? I would look across like three vectors essentially. So one is the awareness side of it. Have a proper nutrition screening assessment happening right in the beginning. So which should be part of the entire standard of care process, for the healthcare provider. Second is for you to make a shift in the patient, you need to do this at a behavioral level, at a belief level, and therefore getting in the right trained nutritionists and dietitians as part of this entire standard of care protocol is extremely important. And the last part is about the whole implementation side of it, where you elevate the role of nutrition, which is treated at par along with the therapy. And that's where the patient should be able to see and monitor and assess what they're taking in and how it is contributing to the overall health. So that's how I would look at, in terms of how you overcome those challenges.
I excellently summarize the basics of the start of the therapy on nutrition perspective, the guidelines, the definition of screening, the definition of treatment modality. Absolutely rightly apt point. Uh, Prasanjit, I have another question for you. So we know that there is a growing incidence of NCDs amongst population in India and increasing the nutritional information and education. You already mentioned good about the screening part of it. But how are pharma and wellness companies addressing this gap? Any initiatives undertaken at industry level?
Yeah, so first, I think we need to understand the growing incidence of NCDs. The non-communicable diseases, which are basically attributed to the 3 or 4 behavioral risk factors. So one is unhealthy diet. You have lack of physical activity. There's a lot of processed foods which is being taken, and use of tobacco and alcohol also kind of compounds this issue, right? And look at some statistics out there. 65% of the deaths in India as of 2019. I was going through an article is due to NCDs. Now, there's a lot of work that's happening, and absolutely, from an industry perspective, and I think things have changed in the last, let's say, 5 to 10 years. One, I think the industry is taking a keen interest. You find that from a regulatory point of view, also there's a lot of keen interest around this area, whether it is by the FSSAI and the whole approach today. I think from both the industry as well as from the regulatory as well as from the scientific community is to augment the reach of primary healthcare and access to the overall health and wellness. So I think the wellness agenda is becoming more and more important. At least that's what I kind of see. Also, if you look at, so there was this whole report which came in from the Nutrition Spotlight Index, which is a firm based out of Amsterdam. And they spoke about some of the key challenges when it came to nutrition from an India perspective. And therein they highlighted in the last 6 to 7 years, there's been a major change, when it comes to some of the actions, at least by some of the leading companies, where fortification of products is seen as a very key area of, from a industry perspective. So whether it is in terms of reformulating the products or in terms of creating new product opportunities, which are aligned to the needs of the consumers or the patients. So that's something that's happening. And I think the other third part, which I would probably think about, is around the prioritizing the patient education and the risk assessment, which I think is still premature, is still nascent, but a lot of work that can happen both from an industry as well as from a government point of view.
Yeah, I think if I see a nutrition market, we have a lot of platter, but the basic start is something which has not been initialized in a proper way. So what happens is we keep adding in our diet something or other else which is we don't know exactly is going to benefit for us. That's why the initial part is something which we have to inculcate in our HCP perspective, so make sure there is a solidarity coming into the overall nutritional value chain. Prashant, I have a very important question from you, because this is we have start seeing that there is a gap into it. What is your point of view in terms of significance of nutrition for hospitalized patients?
Yeah. So first of all, I want to add one more point, like what Prasanjit has suggested. Like if you will see Indian scenario, the one of the biggest challenge what we feel from clinical nutrition and hospital nutrition perspective is there is no specific Indian guideline. Now, if you see, some of the people are following European guideline, some of the people are following American guideline. Now, in that, there is no specific protocol in India, or there is no specific guideline. Now, if you will go to Tata Hospital, for example, they have their own guideline for cancer patient. But if you will go to Apollo, then they have their own specific guideline and protocols to treat the cancer patients and the kind of nutrition which needs to be given to the cancer patients. So I think the first foremost responsibility of industry and healthcare industry, and simultaneously with this top doctors, that we should align at least IAPN or any kind of Indian Association of Parenteral Care and Enteral Nutrition, and to have one particular specific guideline or protocol which can be taken care of and which can be implemented in hospitals. So at least a kind of standardization of treatment can be done. So that is one of the point what I think I should be adding, because that is one of the
Correct.
major challenge what we feel as a pharma marketer and the people who are meeting these doctors.
And this has
Now,
been in medical care also. So India still are struggling to create common consensus based on the disease associations and all. So
yes,
yeah, totally agree with that.
yeah. So now question was the significance. Now, whatever the clinical data which has been published, whatever the clinical data which has been generated in India also, it clearly shows like how nutrition is playing very important, significant role in the recovery of the patient. Now, many of the recent studies which has been published has clearly shows that any patient who has been taken care from nutrition perspective pre-operative, their post-operative recovery is very good. Now, if you will see, many initiatives also has been taken in that scenario, and it has been proven through various clinical data, clinical studies, that nutrition is playing very important role. And specifically, cumulative energy deficiency, it's the worst because it is directly impacting lean body mass. And if there will be a cumulative energy deficiency and protein deficiency and protein malnutrition, that it has longer hospital stay, it has longer ICU stay, which has been clearly established through various guidelines and various clinical data. So I think nutrition is playing very important role. The only thing is, now it is a multiple organ failure kind of situation many of the time in the ICU. So we should be very clear what kind of nutrition we are planning to promote, and prescribers should be very clear that nutrition should have that positive impact. Because of multiple organ failure, somewhere electrolytes are not good, somewhere some nutritions are not good, somewhere some vitamins minerals profile are not good, somewhere excess protein is not good in nephro cases. So challenges are, obviously nutrition is playing very important role, but how to give it to them and what kind of system or what kind of parameters needs to be continuously monitored, that is also going to play very important role. And only because of this challenge, where sometimes doctors get negative impact also, they stop utilizing nutrition. But that is the need of our for the industry also, that it should be clearly discussed that in that kind of situation what can be refined and what are the changes can be made. The major thing, what my perspective, why nutrition has not been utilized in some of the hospitals or it has not been utilized by some of the doctors, that is only because of some of the impacts they have feel, like in parenteral nutrition, thrombophlebitis. It is very simple. It can be taken care very easily, but because of thrombophlebitis, doctors are not utilizing parenteral nutrition. Sometimes it is only refeeding syndrome in case of enteral nutrition, but only it is a very small thing, actually it can be taken care of, but because of that,
Hmm.
doctors are not utilizing. So from my perspective, it is has a significant role and it has been proven through various guidelines and studies. But some of these adverse reactions has uh, still minimized their importance and utilization in some of the hospitals, which can be taken care of. Yeah.
Very apt. I think two important note which is coming from Sean point is how to pick a right nutrition for the right patient. That's very important because every health nutrition supplement is not for all kind of hospitalized patient. Second thing is guidance force to make sure to tell the doctor in a right way that this is not meant for this patient. If you're giving this, ultimately there might be some other repercussions coming out of it. uh, on the same note, when it comes to marketing angle, to understand that how a best marketing practice can be done on this perspective. Satyajit, as you are from that company which has been very much well, acquainted with the nutrition perspective in India, that is Nestle. So knowing fully the ground in terms of how importance of education and knowledge is really important at both angle, patient angle and also HCP angle. So what
Okay.
kind of marketing in promoting nutrition therapy in clinical setting is very going to be important, topic lineup. So what is your point of view into it?
Okay. Udit, so I will add another dimension to it. Apart from the companies or the HCPs and the patients, there is another important factor that is in play, which is the government bodies. So, for example, we have this Indian programs of like Poshan Abhiyan or this TB Mukt Bharat, which has identified that nutrition is going to help, improve the TB status, right? So it's not just one isolation factor working towards this nutritional management, but rather a set of different entities coming together. Now, coming to this marketing part, of course, before that, how do we promote the products? We need to identify what are the kind of products or the solutions that we need to offer. Okay, so if you ask me the broad nutritional challenges, it can be in two parts. One is, of course, the insufficient intake, the problems arising out of that, or on the other hand, unbalanced or excessive intake. Okay, now a program needs to provide the people with the adequate information and the motivation, and this is where PD had very efficiently mentioned, and I resonate very strongly with it. The behavioral changes. So it has to be ingrained in certain ways that the people are able to adapt or modify the behavior, and motivated enough to make that change. So, and I'll illustrate with an example. So we were working on a particular gut health solution in my previous company, and we were working at particular solutions. Now there are some very exciting formats like gummies and chocolates and all those things for gut health. But what happens is the target we were addressing to, your 50 or 60-year-old, they were not resonating with that product concept at all. So understanding your core patient base or the consumer base is extremely critical. And so, for example, a gummies might be very relevant for a teen or a young child, but not so much for maybe a 50 or a 60-year-old, maybe. So that understanding is extremely important from a marketing point of view or from an organizational point of view. And as I mentioned that, the solutions that we offer need to be three things. One is affordable, one is needs to be available, and the third is needs to be acceptable to the person, whether it be in terms of the flavors or the kind of formats or the kind of benefits that they get out of it. Now, as a collective set of organizations, we have a role to play in educating these set of solutions to the patients, whether it be through engagements with the HCPs or say community engagements. So, for example, recently we did one community engagement with a set of diabetics through a social media platform, where we brought in some nutritionists and then created content in collaboration with them, and then communicated the same to the community members. So these kind of collaborations are definitely helpful to build the consideration and build the relevance for the core patients. And a set of it's not just like you do it once and then stop it. It's a continuous journey. Nutritional therapies or acceptance continues to change over the period of time. The solutions, the innovations and renovation programs that the companies are working with is a continuous process, I would say. And our task is to break this complicated informational areas into bite-sized pieces, which is easy to absorb and digest by the consumers, and understood in an everyday setting.
So just want to add another question into it. You talked about the behavioral segment, that how a HCP, the decision maker, keeps revolving around the likability of that particular product. They certain factors, XYZ factors. But when it comes to clinical setting, it's all also very important to understand what is the one thing where doctor have an intent to prescribe. That still is something which is keep changing, because maybe your product have the same constituents of composition which other companies also having the same perspective. But how to make sure that throughout the marketing angle you create the intent to prescribe for your, let's say, your brand. So which are the key things which you want to add it upon into it?
Right. So, see, our task for the HCPs is to simplify their lives so that they are working to facilitate, and our task is to facilitate them to serve their patients better. So, for example, if say a diabetic patient comes to a doctor, so like apart from the medicinal solutions maybe, or say dietary or lifestyle changes, so is there a holistic way to manage their overall dietary journey or the nutritional status through particular supplementation? So educating the HCPs and providing them enough relevant supporting documents to it, or the studies that are done, so that is going to build a credence and believability among the HCPs. And of course, if they are convinced and they find a merit in it, they would definitely recommend to the patients. So it is, I would say, a responsibility for us once again to educate the right message to the HCPs.
Thanks, Satyajit. I think very rightly captured important point in terms of marketing the nutrition therapy. Another question which I want to highlight is something which we really would like to have a feedback from all three of you, because we have initiated this uh, point in our all the conversation what we have till now is basically, is there any technology or tool to monitor the impact of nutrition on the overall health of the patient during hospitalization and in recovery journey patients? So would like to understand, let's say start from Prasanjit, what is your point of view there?
Yeah. So I'll, Udit, what I'll do is I have a point of view on the earlier question that you had asked before I kind of get to this question. So first, I think, how do you, the conversation typically, if you look at it, one is how do you integrate nutrition as part of the overall therapy? I think that's the bigger conversation. And there is a construct, and there's a fantastic model which I'd seen earlier, which is the wellness continuum. This was first introduced by someone known as John Travis. Now which describes the overall state of well-being. Now, if I were to visualize this for you, so in the middle, if you were to see optimum health, and on the right is where you see good health, wellness. If you move towards the extreme right. And if you start moving towards the left, is where you start seeing poor health or suboptimal health, poor health, and disease. So, and then probably, as the disease progresses, then probably death. Now, the goal of therapy, essentially, if you were to look at it from a pure medical point of view, is to move the patient, let's say, from disease to cure and avoid death. So to ensure that it doesn't move towards the extreme left and it moves more towards the right. While nutrition straddles across the entire spectrum. Now, I think that's a conversation that typically never happens. Now, it's very logical, intuitive, scientifically, more or less we know, we have the data out there, the evidence is out there. Just look at some of the data points. If you bring in nutrition along with the regular therapy, it improves the patient quality of life. There are clear markers to kind of suggest what are the quality of life parameters that could be impacted. Now, if you look at certain other data points around reduction of hospital stay by around 21%, reduces readmissions, by around 39 to 46%, and overall therapy outcomes has improved dramatically. You make the right nutrition intervention at the right time, and which reduces treatment cost. I think that's the conversation that needs to happen, which is typically not happening. Now, coming to your question, what are the kind of technology or tools, which is there? Uh, just let's look at what's happening today. With the consumers demanding, or the patients rather, or the consumers, you take both, they're demanding more from the food system. There is a discerning audience there. They go online, they gather a lot of information. There's so much amount of information out there. Now, what they're demanding is they need something to support their health and well-being, which goes beyond products. So innovation is going to become a very critical part in this whole journey. And one of the big things that's happening is this whole targeted nutrition, which is growing and is going to grow at a fast clip across, whether it's global or from an India standpoint. Some interesting things that's happening from a technology or tool point of view. There are some very high quality food and lifestyle diagnostics. So I was looking up through some literature, found some organizations, a fantastic organization, which is working in this area, Lu Wei, which is a scientific spin-off from the Technical University of Munich. Now, they have created some tailored food supplements that basically addresses the necessary vitamins, minerals, and substances specific to the patients. Just imagine the kind of work that's happening there. Now, there are also consumer-facing digital platforms. We are aware of it in our country, which is giving personalized nutrition and advice. Then you have AI coming in, which is driving health and wellness, in a big way, where you have coach and nutrition screening tools. I think we still have a lot of catch up to do, at least from a nutrition screening point of view, but that's already happening. And then you find targeted nutrition, which I spoke about, whether it is genetics, whether it is customized solutions, whether it is microbiota-based solutions. There's so much data from wearables. All of us are wearing smartwatches today. There's so much amount of data that's being accumulated. New biomarkers are coming in. And I think one big conversation that's going to happen moving down the line, and wherein this could be a very big tool, is a microbiota-based solutions, to personal care, health management, disease management, and overall wellness. So I think there are a lot of things that's happening from a technology and tool point of view, which could improve the overall health outcomes of our consumers as well as our patients.
That's very exciting to learn about the key aspects in terms of monitoring perspective is happening, and it's going to be very interesting when it will be rolled out and how it's going to change the paradigm shift in terms of nutrition perspective. Any point you would like to add, Prashant, into it? Prashant, can you hear us? Hello, Prashant, am I audible?
Udit, I
It's
may.
fine. Yeah.
Okay.
Yeah, Satyajit, if you can
Okay.
just.
Yeah. So adding to what PD was mentioning, so apart from the consumer front, so there is going to be a lot of adoption of technology, computerization of the different tools, which will be relevant for the HCPs. That will possibly help reduce their workload and the kind of time spent in assessing their patient for signs of malnutrition. And I know, of course, the journey is very long, and we need to adopt solutions that can help impact the nutritional status. But there is a concentrated effort in encouraging and educating about these tools. For example, my colleague who leads the acute care portfolio in Nestle Health Science, he is working closely with a select set of HCPs to implement such monitoring tools in the hospital setup. And in fact, I was reading about a solution called Nutritech. It's in the
Mhm.
Europe markets, where they are working on improving the dietary intakes and patient engagement in a care facility. And further studies are, of course, required to validate its effectiveness and through maybe RCTs and all. But it is an important factor that these tools are going to be helpful to the HCPs to manage their patient status better.
So that means you're saying is it's like a sample kind of initiatives where FLS system, where licensing
Right.
services to specific ecosystem has been started
Yeah.
initiating to get the right nudge exactly how much it's going to be benefit for the future perspective, which is a
Yeah.
handsome start because we know in medical science also it starts from that. How is it going to change the overall the likability towards the decision making? That's a very important component into it. Yeah, Prashant, am I audible to you now?
Yeah, yeah, it's fine.
Please go ahead.
Yeah.
Any
So
point
from
you would like to add? Yeah.
Yeah, so like Prashant and Satyajit has talked about, there is more about consumer market
Mm.
specifically who are buying their nutrition and they are keen to understand about their nutritional status, and based on that they are buying the products. Now, if I talk about clinical nutrition specifically, which has been utilized by HCPs and specifically in ICU or admitted patients, then as per my understanding, SGA, that subjective global assessment, it is the most utilized tool to assess the patients and to see the patient's journey, like how it is improving. Body weight and BMI is also playing very important role. CMC, that is also going to play very important role. But specifically over, like there are so many scores are there. Apache is there, SGA is there, some other tools are also there. But well accepted in India, and when I talk about clinically, specifically HCP, then SCGA, the subjective global assessment, SGA is the most accepted tool which talks about assessment and which talks about it. Now, one more point I want to add, which is not relevant to this question, but our previous discussion. Like one of the things what we have observed and what we have learned and experienced, like in clinical setup, when we are doing some kind of study with HCPs, and when they are seeing that result by themselves, then also many of the times their practice is going to be changed. Like for example, we are talking about partial parental nutrition or supplementary parental nutrition. So mostly SCPs are not utilizing in wards, they are not utilizing in ICUs. But when we have initiated one campaign and we have started telling them that by utilizing them, these are the going to play a very important role and these are the scenarios we're going to change. And we have helped them and we have sponsored some of the tests, uh,
Mm.
blood test, chemical test, all this post utilization of that product and pre utilization of that product, which has given a very good result because that has
Mm.
ignited that thought in doctor's mind, HCP's mind, that yeah, as of now I was not aware, I was just aware about the data which were present, and I have myself not analyzed or myself has not done this kind of anything. But by sponsoring certain tests by a company like us, they themselves have realized in their own patients that if they are giving this kind of product pre-operative, post-operative, how it is going to play a very important role in their recovery. And this kind of small study, which is not costing more to the organization also, and simultaneously it is very easy to be done also. Their thought process has been changed, and that thought has been ignited in their mind that they should utilize it. So that is also going to, this kind of campaigns have also helped to create that kind of awareness in HCP's mind.
Yeah,
Agree.
Udit, can I just add, to this conversation, because on the tools itself, while the SGA is something that Prashant has spoken about, I think there are clear guidelines which has emerged. Whether it's the SPEN guidelines, which basically talks about, and that's something that needs to be implemented as part of the whole, standard of care across hospital setups. In the overall assessment of the nutrition status of the patients. So where there are tools like the nutrition risk screening, which is a tool which helps in the inpatient for inpatients when they come in, you do a nutrition risk assessment, and you're able to then tell them what they need to do. Then there is a malnutrition universal screening tool or a MUST tool, which is for the ambulatory setting. And then you have the mini nutritional assessment tool, which is used for institutionalized patients. So these are tools that are there. Some of them look a little bit complicated, maybe from a patient perspective, but I think there is a huge opportunity kind of, trying to bring in technology and make them a lot more simpler, at least from a patient point of view. And then you'd find more adherence and compliance becoming much, much better. So, yeah.
So fulcrum is all about, we know that everything is on paper. We have the guidelines, we know the tools. The point is the implementation part of it. The percentage is quite low. So if I see this is one of the biggest problem statement in India, any kind of therapy perspective, how we can, increase this behavior of a doctor that start doing this, so that there is a absolute treatment modality for the patients based on the profile to profile. That's what we have to. That's what marketing is all about. How we can increase that, gap. Sorry, minimizing the gap part of it. So apart from that, in terms of tool assessment, what we have talked about, we have a very interesting video from the nutrition expert, which they have highlighted some very interesting point on this perspective. So I request to play upon this video.
Available. But when we talk of any tool, we always look for something which is validated or which is accredited. Just for example, there is a software iNutrimon, which is accredited by NABCL and is also endorsed by ISPAN, which is the Indian Society of Parenteral and Enteral Nutrition. Now, when we look for such software and when we are talking about measuring the impact of nutrition on recovery or overall health of the patient, there are a lot of points which needs to be considered when we see nutrition as a impact factor. So nutritional impact can be measured by various tools where you do the risk screening. So you say the nutritional status, initial nutritional status of the patient, then you do the nutrition intervention, then you monitor the intervention of whatever prescriptions you have set, and then you will also assess the recovery support changes in the biochemical parameters. So any tool which is focusing in detail on all the aspects of the ADEME process of the nutrition intervention and nutrition care process, it's ideal.
Sometimes, like when experts talks, it is always delight to talk about, understand the perspective. But knowing fully as an individual post pandemic, I think the nutrition awareness in any kind of population has gone really in a different segment, because ultimately everybody started understanding the importance of health. So I think this is something which is relatively changing the overall ecosystem. Adding to the very important question, which something which I would like to add from PD and Satyajit is, how a digital transformation changing the nutrition care, and in which way DTX, digital therapeutics, can impact the future of healthcare.
Okay. Well, I think the Moore's law is in full force here, I would say. And in fact, if you look at the recent trends, there was a fantastic case study where a patient, a conjoined twin in Brazil, was operated by a set of doctors based out of London. And so, in fact, at home also, like the TN government, for example, has created an app which can help detect early stage cataract. So all of these things are happening in the healthcare space, and the nutrition management is not going to be any different. There is going to be an exponential uptake in this, especially because of two factors. One is the combination of this low patient to doctor ratio, and the fact is there is a huge increasing penetration of internet and smartphone usage. So these two factors are going to help accelerate this digital interventions or digital therapeutics in the healthcare space.
Nice interjection. PD, any points?
Yeah, just to add to what Satyajit is saying, so if you look at overall digital transformation, it's essentially impacted all of us, and I think there are two key drivers there. One is convenience and the whole experience, and which is cutting across all industries. So it's not very different for healthcare as well, because even healthcare digital transformation in the healthcare is now trying to make the best use of the latest technologies, the methodologies, processes, and delivering sustainable value to the patients, and as well as the healthcare professionals and the healthcare organizations. Now, there was a recent paper from Deloitte which shared around 92% of the healthcare professionals and institutes achieved better performance from digital transformation or adopting digital transformation. In terms of better, more and more personalized services, this better communication with the doctors, the awareness amongst the doctors has increased considerably because of digital transformation. Easy access to personal health data of the patients, tracking the health metrics in real time, just helping the doctor and the patient to develop a very strong understanding of where the patient is. And then also in terms of the appointment scheduling, as basic as something like an appointment scheduling. So for me, the future of healthcare will undergo a paradigm shift from becoming a diagnostic and a prescriptive kind of a system to a more predictive and holistic care approach, for the patients. And digital therapeutics will obviously front end that conversation to predict and manage patients' future health rather than just reacting to symptoms. So I think this is going to change dramatically. The emerging treatment will be more evidence-based, which will undoubtedly have an immense impact on the patients, especially with the integration, let's say, of advanced AI analytics and better healthcare parable solutions which exist. So where there is a symbiotic relationship between the healthcare provider as well as the patient.
Totally agree. I think DTX is something which has come up very well, and we have seen a lot of good examples, and in real life stories in my family also, and a lot of you must have also experienced how DTX is changing the overall health system in your families, specifically the daily schedule of it. Monitoring every single aspect. If you're a heart patient, if you're a BP patient, making sure that right time you're taking medicine, the walk part of it, your sleep patterns and everything. So the transformation is all about, because our life, our treat, the way of life is changing. The really DTX has really changing the overall paradigm shift in terms of controlling the environment of yours, which is somehow a beneficial perspective for the patient's area. Though in nutritional area we see this is a advancement, a pinch of it, but maybe it will become much better than when it comes to the medical therapy part of it. So great addition of these points. I think we are going into the some of the couple of last questions so that we can have proper time in terms of taking the questions. So how does nutrition looks like in the future? Prashant, any point?
Yeah. So from my perspective, there we have discussed many of the things. Many of the things has been improved in last several years, in last decade, and still many of the things needs to be improved. Now, if I talk about specifically clinical nutrition, now there should be integrated approach. Now, many of the times, what happen? The doctors are treating patients separately, dietitians are giving their advice separately, then patient has their own choices also. So now I think in near future there should be some integrated approach where some kind of nutrition support team can be created in hospitals. So in the nutrition support team there are various departments, people can be part of that. So the people who are responsible for assessment, the people who are responsible for disease management, the people who are responsible for nutrition management, or physiotherapist or anyone else, like they should be part of that team. And if that team will take care of the patient from the admission of that patient till the recovery path, then it is going to play a very important role, because nutrition is not only a thing which needs to be taken care by nutritionist and prescribing nutrition, but there are so many things which has been starting to end, it is playing very important role. So this kind of nutrition support team, if some of the hospitals, specifically in corporate hospitals, if it can be developed, then it can play a very important role and it can make patients life also easy. The second is like what we are also working on, that it is total nutrition management kind of concept. Nowadays in clinical practice, despite of a lot of information, knowledge, trials, still we think that there is a huge gap in calories and protein. That is because of feasibility. Like many of the patients are not been able to take enteral nutrition. Many of the patients are not been able to take parenteral nutrition. So there is a huge gap in calorie and protein delivery. and which leads to cumulative energy deficiency and uh, issue with the recovery. So in that scenario, if there is a total nutrition management, if there is a SPN concept which can be launched, where supplementary parenteral nutrition also can be given, and it could be a combination of enteral and parenteral, which also plays good role and which can fulfill the requirement. So as everyone has suggested, that many of the things has been done in the last decade, but many of the concepts still needs to be established. Specifically, still I tell that I personally think that there should be some Indian protocol, there should be some Indian guideline, which can actually can be established and which can be very much useful for the patient's recovery, specifically in clinical setting. So I think these are some of the concepts which can be implemented in near future, and which can be a win-win situation for the industry also, and simultaneously for the healthcare professionals also. Yeah.
Thanks, Prashant. Great inputs. I'm like very much getting into the nutrition perspective. My extent of experience in hardcore healthcare, so it looks like very lucrative for me to get into it. So fantastic inputs, guys. I think it's time to have the question and answer session. And first question would like to ask from Satyajit, and this question is from Amrita Pune. What kind of activities can be undertaken to sensitize doctors on importance of nutrition?
It's an ongoing process, as I mentioned, and I gave you the example. I've witnessed the two sides of this at home with my father and brother who are doctors, and at workplace where we have to convince the likes of my father and brother. So it is important that we talk about their practices and what are the possible areas that can help them augment their practice better. So for example, it's not enough to treat a patient through medicines. You need supplementation to meet their say possible nutrient requirements. So for that, if you have solutions at hand, how do you talk to them effectively? So now one of the big challenges is how do you reach out to them? So there can be they are flooded with patients. So trying to find out the right way to engage them is going to be extremely important. You just can't go and possibly leave behind a leaflet and expect the doctor to understand or consume your message. So you have to find out right ways. So a huge focus is being given on say multi-channel engagement. It's not just only about face to face, but
Yeah.
through digital interventions how you can reach out. And then if you are able to crack the right model with the right message and with the right kind of solutions for their patients, it's a complete blue ocean right now, and there will be a huge uptake in this nutritional supplementation among the HCPs as well.
Thank you, Satyajit. I hope the it actually answers the question from Amrita. Another question, actually, this is from both Satyajit and PD, from Mukesh, Kolkata. The question is, how do you engage with HCPs in the area of critical care? As the user is dietitian, the HCPs are decision makers. Since people working in critical care hardly have time for consulting. So PD,
Yeah.
Satyajit, any of you
Yeah.
can.
Yeah, maybe the good news is in critical care. I think it's again a very good relationship between, let's say, the critical care specialist as well as the dietitian.
Right.
So there are very clear understanding as to what is the role. I think the basic challenge happens is because sometimes the key influence is always the critical care specialist, and then you have to reach out to the dietitian. And in case both of them are not connected, then you'll have a bit of a challenge there. And I think this is what typically is this question, from Mukesh.
Right.
So I think what should happen is that you bring both the teams, together, and you need to identify who's the expert, let's say, from the critical care point of view, and who's the expert, let's say, from the dietitian point of view, and bring them to the same platform and have an engaging discussion around the critical areas around, let's say, the ICU nutrition. So just as an example, you pick up an area of ICU nutrition. Why is it so important? What's happening? What's the current changes, that's happening from a protocol point of view? And
Right.
both the teams are engaged together. And I think once you do this over a regular period of time, and you're building enough capability and capacity within the ICU setup, you'll start seeing great results coming through. But I think there is no clear one answer for it, but bringing both the teams together and engaging them in a fruitful dialogue.
I think very aptly said, because back to the basics point, that if an expert for nutrition is nutrition expert, if they are aligned with the critical HCPs, then only there will be a kind of vibrance or a kind of consensus what exactly is required. The importance always felt from the expert point of view. If I am going and just communicating that to the critical point of view, maybe they will not accept it as what they will take from the nutrition point of view, because this is what happens, that how and which channel of communication is required to make sure that you are trying to give the right impact to your point. So very valid point. Prashant, we have covered this particular question which I'm trying to highlight, but yes, I want to have a little bit concrete answer is, how do you market critical nutrition? And when different hospitals have different guidelines, and according to you, does this have an adverse impact on patient's life also?
No, like if you have observed and if you have seen also, like the formulations, specifically in enteral nutrition formulations, we have specific formulations which has been decided. Like in critical care, if you require protein, then it is 40 to 45 percentage protein concentration which is required for high protein products. If you think normocatabolic patients, their requirement is approximately 19 to 20 percentage of protein, and rest of the requirement can be fulfilled by carbohydrate and fats. So obviously we are not having guideline, but overall the things are decided. Like for normocatabolic patients, what are the requirements? For the hypercatabolic patients, what are the requirements? So there are some formula which are the calorie dense formula, giving 2 kilocalorie per ml. There are some high protein formulas. There are some immunoenhancer formulas which are specifically driven for immunoenhancement. So yes, we don't have guideline. If we have guideline, it can help much more, because then the things will become much more easy, and industry also can develop new formulas based on the guideline. But in current scenario, it is very difficult for the industry to have all the formulas for different needs, and that is why somewhere it has been aligned for normal catabolic, hypercatabolic, high protein, and disease specific formulas. And accordingly we need to have that formulas, and accordingly we need to market those formulas. And the only differentiation points can be some of the important nutrients, because as a whole you cannot have something innovative which can
Right.
be totally different than what are the things available into the market. However, you might have some of the important nutrients, you might have some of the micronutrients which are important in that particular need, some immunoenhancement or immunoenhancer which in that particular need, which can be highlighted, which can be marketed, uh, to create that differentiation in prescriber's mind.
I think one more addition to this point, and we have a couple of questions based on the guideline perspective is, rather than in the marketing area, it's very important that which of the bodies who have been impaneled and have some kind of certain positioning in terms of respect across the fraternity, start with that, because customization can be done based on the corners and everything. In the marketing, this is very important to understand when you start communicating, because a lot of people are asking the same concept point. How I make sure that when I communicate about that this is my product and based on guidelines. So if your guidelines are very much intact and your product is very much intact with the guidelines, you need to throw the message properly. That's very important. And based on that, then you can take the decision point of view. We have a very different question in terms of premature pediatric population, and this is, I think, pretty your point. Where do you think we need to move in the future to provide required nutrition? In
So I didn't get that premature. What is the question
from
specifically?
perspective of premature pediatric population, where do you think we need to move in future to provide required nutrition? This question
Yeah.
comes from Shashank Krishnan from Ahmedabad.
Yeah, so when you look at the premature babies, so you have the low birth weight babies, you have the extremely low birth weight babies, and the very low birth weight babies. The nutritional needs of these babies are extremely different, and therefore, and what typically needs to happen is you need to give them a catch-up growth, because there is an intrauterine growth restriction in these children, and the catch-up growth is extremely important. So you want them to attain that normal birth weight, which they ideally should have got, if they were born in a term as a term baby. Now that's where the intervention needs to happen, and there is a clear protocol when it comes to these babies, and the kind of nutrition that needs to be provided. So essentially, it is about protein, giving the right energy density, and ensuring that the protein is not so much, you don't overload the system, because these babies are extremely sensitive. So while keeping all of that, along with a good micronutrient profile, is what you would want to deliver. So there are clear guidelines when it comes to these babies, and the nutrition needs to be absolutely appropriate for the kind of babies that we are targeting. Yeah.
Thank you so much, Prasandeep. I think there are some couple of questions, but we have covered in our overall discussion. I hope every query has been properly handled, and we are almost all also finished with our timelines. Fantastic discussion, guys. I think the attendees must have taken a lot of inputs from it, and it will really help them for ideation perspective in terms of for their product related queries or any kind of challenges. Hopefully this recording will also help them in future to answer their questions and challenges. Now I think I would like to have small message from all three panelists in terms of nutrition and patient care. What are the key message they want to pertain before we end the session? So let's say, Prashant, what's your final take on it?
Yeah, from my perspective, like as I have discussed in my talk also, like many of the things has been improved. Like if you see, last decade was very good for it. Actually, many of the new initiatives has been taken by healthcare industry also, and simultaneously pharmaceutical industry also, and many of the initiatives which has been implemented, which shows good way. However, many of the things needs to be done also because it is a long way to go. Guideline, as I strongly emphasize, guideline needs to be there. It should be established guideline for Indian population. Still, we need more clinical data from Indian, because today we are majorly depend on Western countries, or majorly we are depend on foreign countries for the data. So we should have more data on clinical nutrition from Indian
Right.
population perspective,
Right.
and we need to establish some of the concept of total nutrition management and nutrition support team in various hospital setup, which can improve the life of uh, patient, and that
Mm.
is what I think. So there is a very good future, and many of the things and many of the platforms has been created. On that, it can be a good way we can build in the future. Thank you.
Thanks, Prashant, for your key message on which is circumventing about the Indian guidelines and Indian research point of view. That's very valid point. Satyajit, your key message.
All right. In order to, I would say, improve the nutritional status of the entire population per se, it has to be a collaborative effort between the different bodies, whether it be the government bodies, the HCP fraternity, and the organization. And from a marketing or an organizational point of view, our emphasis should be on three things basically: ensuring affordability, availability, and acceptability to the person, so that they are able to adopt the new nutritional solutions without a significant change in their behavior or their mindset.
Correct. Absolutely. Bang on. Absolutely. Final panelist for us, PD, your
Yeah.
your take.
So I was seeing a few questions on from the product perspective, from a marketing
Yeah.
perspective. We know the funnel, we understand, the kind of engagements that we need to do. We know the medias, so this the whole omni-channel marketing or multi-channel marketing that you can do. But I think I'll just give a little bit of a framework that people can think about, because today when you look at whether it's the patient or even the doctors, there's enough of information out there. So I think from a marketing standpoint is how do you curate, how do you kind of customize those, that information which addresses the core need of whether it's the
Mm.
patient or the doctor. The second one is from a messaging point of view. The messaging needs to have a very, very clear understanding around what's the hook. How do you attract or grab attention of your doctor or your patient, and therefore it can't just be simple bland messaging. There needs to be some entertainment value also along with the messaging, which I would typically
Right.
call something edutainment. And the third part, let's say from a marketeer's point of view, is when he engages with the doctors or wants to reach out to the patients, it's all about reach and scale. So how do you create that access? Now that's fundamentally from a marketeer standpoint. Now, from the other conversation around what should ideally happen, I think nutrition should be treated at par with cure and therapy,
Mm.
and therefore the benefits of therapeutic nutrition needs to be probably emphasized enough. And that's where I think a lot of responsibility lies with industry to work in that direction. Whether it is in terms of managing and controlling your functional diseases, whether it's the heart disease, diabetes, stroke, cancer. or looking at areas like high blood pressure, stress management, reduction, or overall well-being and cognition. So across the entire spectrum that you can think about, nutrition plays a very big role and has to be integrated along with the entire therapy part of it, and that's something that's extremely important.
That's the most challenging job for the marketeers when it comes to making sure that nutrition is also dating the same value like the medical therapy. So it's a huge task on everybody sitting and listening to this particular discussion, because ultimately if we stand by that nutrition is going to be having the same platform, we win the race, because ultimately what is our intent is to make sure that patients better outcome. So that's what it's all about. So it's a wonderful, fantastic session, I think, and I would like to call upon the curator of this program to say the final end, Mr. Hans. Over to you.
Yeah, wow, guys. Thanks so much. Thanks, Prasanjit. Thanks, Prashant. Thanks, Satyajit. Thanks, Udit, so much for moderating the session. And I think we should rename GAPSULE today's program to GAPTrution, something like that. Because this is the first specific talk in clinical nutrition in the healthcare industry. And if I was following your conversation, it just has been brilliant. Because if you look at I mean, it's possible because only of the panel has just been terrific. And if you look at what you all been covering, it's not only the now, but also a bit of the history, the future of clinical nutrition, the gaps in terms of the education to HCPs, strengthening the collaborative approach between the physician and dietitians, and coming up with guidelines. I'm hopeful that the body, that's ISPEN, which is reformulated, will be looking at doing just what Prashant has been reiterating throughout the talk. And I'm sure with Satyajit's inputs on marketing aspects of the AAA, the available, the affordable, the acceptable by patients and at the HCPs, and what Prasanjit has been saying in terms of marketing is also like, almost chopping, cutting the loads of information, masticating, you would say, the information for HCP digestion. I'm just using puns of the nutrition world. So, thanks so much. I mean, there was so much importance talks that you all were covering, the important points that you were covering during this talk. So thank you for taking your time out, for being a part of this program. And we know that nutrition is in safe hands because of leaders like you all in the space. And I want to thank lastly the audience for participating. So thank you all.